Hi, good afternoon, everybody. My name is Dr. Sharyl Truty. I am a physician who practices here at the beaches, a combination of primary care and holistic and sports medicine. We're here today with our noon lunch hour Facebook Live talk. Today, we're talking about our series on engineering longevity and vitality. And specifically today, we're talking a little bit about anti-aging and sexual health. Today with me is Dr. Marisol Moon. She is owner of NuMoon Regenerative Medicine. She's both board certified in physical medicine and rehabilitation, as well as pain management. And she's one of the physicians here in Jacksonville at the beaches, sort of leading the way in some of the unique regenerative medicine therapies that are available. So, today I think we're to talk a little bit about hormones and anti-aging in general. I think when people talk about anti-aging, one of the things that they, talk about is sort of, okay, how can I, extend my longevity? How can I make myself, feel better and just be able to have a better quality of life? As we get older, that we begin to sort of notice that things in our body, are changing. And so, one of those components, as we talked about is sexual health, right? And just it's a topic that not a lot of physicians necessarily want to get into because it can be a topic that, has a broad range of different things.
Right. Yeah, I mean, exactly. There's some new things that are out there that actually have been helpful for a lot of patients that have been suffering from issues with their sexual health. But in general, there are it's a taboo topic sometimes with patients and physicians because of some of the lack of treatments that have been available, and in traditional medicine, especially for women. Medications that are not really available for women if they want to increase their libido or have changes as we age. I mean, just in general, we all reluctantly age, but there is no single magic bullet to help stop the aging process. And so, as physicians and as pioneers in innovating new treatments and trying to do what's safe for patients, there are physicians that are at the forefront of doing things kind of outside the box. And so in general, with what Dr. Truty does with hormones, as well as in conjunction with some of the treatments I do, it helps with a multimodal approach to things. As we age, we find the lack of energy. Right. We find our metabolism changes in terms of sexual health for women and for men. But for women, a common complaint is lubrication issues or sensation issues or pain during sex that they didn't have before. And women that have had hysterectomies or not even in that age range, but women that have had children and they've had injuries during their birth with episiotomies and painful scars and things like that. And they talk to their practitioners and their OBGYN physicians, and there's not, physical therapy can help, but when it comes to other things, sometimes they're just lacking the ability to be able to offer other treatments. And so with the treatments I do, so I do PRP treatments, platelet-rich plasma treatments, and so that's a form of regenerative medicine, similar to, or it is similar, and it is the same type of treatment that people may have heard when they treat athletes.
Yeah.
And so the background behind that, and we're learning more and more, and we're learning the safety aspect of it when it's done in the proper way, is that it can help stimulate healing in certain tissues. Now, everybody's different in their healing process because we range from, when we're babies to when we get older, we are constantly ever changing ourselves and healing. And obviously there are diseases that inhibit that or give us problems, and we see that and we try to treat those. But in the overall sense, when we cut ourselves, when we injure ourselves, our body gets signaled to miraculously though, to heal. Otherwise, we would have that cut that didn't heal and the skin that wouldn't become, skinny again. And so when we have some of these traumas or injuries and things like that, our body sometimes doesn't heal as well, and we know that as we get older.
Right.
In our teens, and when we're kids, we kind of bounce back really easy. We see that, and that's a good thing, obviously. And the turnover of stem cells and things like that are much quicker in the younger population. However, as we age with a lot of things, we start to see that it's just not,
Right.
we don't heal as well.
Right.
And so we use science, and we use some of the medication that we have to help that process along. And so when we start to feel kind of sluggish and we start to have that metabolism issues, obviously the first things to look at, one is actually thyroid, right? You look at, that's the main kind of thing that regulates a lot of things, but if that's corrected or if that's not an issue, then you also look at other things. And there's in general, there's a somewhat of a dichotomy with people with hormones and things like that. And there's new research out there that is actually showing that the cardiovascular effects that they thought were detrimental can actually be
hormones are sort of a complex, topic because, like you said, a lot of times I think people will individually focus on one hormone. I'll have patients come in and they'll be like, I think it's my female hormones, or, I think it's my thyroid, or, what's this cortisol thing that people are talking about. And what we begin to realize is that these hormones all work together and they interplay. And so, any sort of adjustment of one hormone really, sometimes needs to encompass a look at all of them, together, and to begin to see, what's going on. And then, we often find there's maybe a little bit in a lot of different places, and then sort of kind of beginning to pick one and sort of address that.
Right. And then in general, healthy diet, exercise, things like that all play into it. In terms of the treatments, so specifically now going towards sexual health, for men and women, the treatments I do are called O-shot and the P-shot. So that uses your own platelets, and then we inject that back to certain areas of the body to help promote revascularization, to help essentially trick the body that there's an injury to that area. So that starts to signal those platelets, like if you had injured it or cut yourself, to send growth factors and your own stem cell factors to kind of help in that area.
So someone who hadn't heard about PRP, what is that like? I mean, what exactly do you do? Because some people haven't heard of that.
Yeah, so it's so for a lot of people it's a foreign term. They're like, what is PRP? What is platelet? And they have a lot of they kind of guess at what that means. So it's short for platelet-rich plasma, and what that is, it's everybody has platelets. Platelets in general are what, like I mentioned before, when you hurt yourself or cut yourself, is what signals your body to send healing factors to it. So in our blood, we have platelets, and how we derive the PRP is it's as simple as a blood draw, like you go and get your labs drawn for anything. Exactly.
Yeah.
And depending on how much PRP we need, will dictate how much blood we draw.
Yeah.
But it's something that we do kind of on the spot. You can get your blood drawn. It takes maybe 15, 20 minutes for the whole process of drawing the blood, and then we use a centrifuge to spin the blood, and basically it starts to separate out the platelets from the rest of the blood material that you don't need. And then we can use the platelets and some of the other factors that are in there in whatever treatment that we're doing that uses PRP.
So we basically, it's an in-office procedure. You come in, you get your blood drawn, you take that blood, you go to, the other area office, kind of prepare it, take that serum, and then you come back and then you do the procedure on, whatever area specifically you're treating.
Exactly. So it's an in-office procedure, maybe takes from time to finish, maybe about an hour.
Yeah.
That's obviously not the whole time that the procedure is being performed, but in terms of drawing the blood, separating it, and then getting the patient ready for the procedure. And usually the procedures itself take maybe 10 or 15 minutes to do, so it's not very long. However, the process in general of coming in and things like that may take 45 minutes to an hour. And it's fairly pain-free. The most maybe painful part of it is actually the blood draw, but everything else is numbed, whether it's via topical medication or lidocaine. And depending on the patient's desire of more numbing medicine or less numbing medicines, everybody I've seen has a different pain threshold, which
Yeah.
is quite amazing.
Yes.
But yeah, PRP in general, so helps for women, can help for vaginal lubrication. I've had women that have had issues with changes in the skin in the vaginal area,
Okay.
some called lichen,
Yeah.
a disease called lichen sclerosis,
Okay.
and which is another very, very difficult um, disease to treat for patients, where the mainstay at this point is estrogen creams and steroids,
Mm-hmm.
which in itself may help the symptoms, but for a lot of times changes the feel of the skin in that area, which is a very sensitive area where a lot of women have difficulty with any type of clothing that touches that area, very painful for them. And so we've had
Yeah. So
lots
those
of patients.
steroids can just basically reduce the inflammation, or if they're, hormonal creams, maybe they, try to plump up the tissue, but they don't they don't heal the characteristics of
Correct.
the tissue. And that's sort of what you're doing with
We're trying
what
to
your
do,
treatment.
right?
Yeah.
We've seen it actually. And so, steroids in general, even we know for long-term use, topically or orally,
Mhm.
can cause long-term detrimental issues. And when you're using that in such a sensitive area, for a lot of people, that's the only options they've been given.
Right.
And, for some it does help, but then it helps for the symptoms. However, they still can't resume a normal sexual relationship with their spouse or with their loved one. And so, in general, with any of those types of diseases or with aging, we kind of start to have a disconnect with, with intimacy and intercourse with our loved ones. And that's something that, as we age, shouldn't have to not be a part of your life if you still desire it to be so.
Yeah.
And, I don't want to say the word hate because I don't like that, but I dislike when patients are kind of disregarded of saying, it's a natural part of aging.
Right.
When the patient themselves are distressed about it.
Right.
And the only answer they're kind of getting from their practitioner is, it's a normal part of aging. And I think why people say that is because they just don't have a good answer or a solution or something for them to potentially try to help them. And so when you don't have necessarily a good answer or solution,
Right.
you try to find something that's a very easy thing to say of it's part of the aging process.
Right.
And I've had numerous patients that have had their hormones supplemented,
Mhm.
Feel great with that energy wise, still have some lacking ability in performance that they're wanting to improve. And that's kind of where we see good results with PRP, especially even for men, who, in general, sex is a very big part of a man's life and a woman's life too. However, men seem to have much more distress when they start to notice the decline in the function that they had when they were in their 20s. And that's, it is still that aging process, but it is very difficult for men to kind of to grasp, hey, I want to still continue an active sex life. I want to still be intimate with my loved one, my spouse, whoever. And these are solutions that have helped significantly men of all ages, and PRP in general. There are also other treatments that can help for men in sexual health. So there are other things called the James wave or shockwave treatment, which in itself also helps remodel the tissue that's there, so help improve vascularization. And that's what we see in general is that it's a decrease of blood flow to the area.
Right.
It's the organ itself is aging, and so we try to help improve that in a way anti-aging with the PRP. And in conjunction with the hormones and in conjunction with all that, you get now you're getting the signal of the testosterone to help with getting that libido starting to work with with other in your body. And similarly with women, different things for women. Yeah.
So, a lot of the, hormonal stuff, which we can talk a little bit more about, like you said, can, if you feel like part of your issue, to improve sexual health is, sort of, in a sense, desire and libido, that we tend to look at maybe more from a, holistic or hormonal, but the thing about sex is it's still a very physical. And so there are a lot of physical issues that both women and men, run into. And I think, we were just talking about, issues with men, and, I think, it's very easy in medicine to just say, okay, if it's a physical issue, let me just write a pill for that magic, prescription, Viagra, Cialis. But, that is sometimes is not really the whole issue. And so I think, like you said, people and men will struggle with the fact that, that in and of itself doesn't always do the trick, right?
Right, and then time and time again, I do encounter male patients that, have tried Viagra, Cialis, and, it works for them, however, they have significant side effects from it.
Yeah.
And so those side effects just outweigh the benefits of the medication for them, or they just are contraindicated from taking those types of medications.
Right.
And some that it just stops working for.
Yeah.
So there's a wide range of also spectrums of, erectile dysfunction and disease that's there. And, and all of these treatments can help, and in conjunction can make your sex life better and improve as we age. But we also have to look at the side effects that happen from some of these medicines that may be prohibited in someone being able to take them.
Right.
And so now there's an alternative or option for patients to consider to improve, as well as improve the spontaneity of it. So, with some of these medications, you have to kind of time it appropriately.
Yeah.
And for those that are wanting to be a bit more spontaneous with their activities, kind of puts a damper on things.
Right.
And as well as sometimes, the effect of the medication can last longer than they would like it to be. And so then they have side effects in that sense.
Right.
So, it gives a bit more spontaneity. It helps kind of bring back the natural kind of aspect of intimacy with a partner, and in general can help in all those areas. And in talking again about maybe other factors and issues and things like that. PRP is used for a lot of different things. So we mentioned before that it can be useful in chronic injuries and acute injuries to kind of help speed the healing process of things.
Yeah.
And in general, in the whole anti-aging spectrum, can be used a lot with aesthetics and things like that. So PRP in general is not just for joint aches and pains and for sexual health. Can also be used for chronic pain issues with joints and tendons and ligaments, and actually muscular and other regenerative techniques can help for that, as well as other cosmetic issues like hair regrowth and things like that. And that's also part of an aging process. Maybe not so much sexual health plays a part in all of this that we talk about, because when we talk about the hormones and things like that, it's not just the sexual hormones or hormones that affect sexual health, but really affect our body in general. And hair loss is one of the things too that people kind of have as they age, issues and complaints about, and don't really know again what to kind of do. And it stems back to dietary issues, thyroid, other things that may be potentially contributing to that. And there's also hereditary, androgenic alopecia, hereditary kind of issues, which are different but can help with these natural techniques in PRP to help kind of stimulate the hair growth again and keep kind of the hair that you have. So lots of kind of uses for it, and more and more people, as my clinic is getting busier and busier, more and more people are recognizing that that with the limited traditional options, they're looking for other options to help with it, and finding that a lot of people and patients have had success with it in all these areas. And so more and more people are turning to these type of treatments to address the age old questions of how do I treat these types of things.
Yeah, absolutely. And like you said, I think there's a lot more clinical applicability of again sort of these unique injection type techniques. I mean, I think when people think about injections, they obviously jump to steroids and nowadays even people think about stem cells, but there's sort of a variety of things that fall in between those things. And I think a lot of people just kind of don't realize, that there's sort of a lot of these different applications.
Right, and we'll kind of touch a little bit on stem cells. And so stem cells in general, that's a very hot topic. We're on Facebook and all these things. And so, if you've ever, Facebook and the internet listens to everything that we say, as well as, the things that we type in. So, if you've ever looked up PRP or stem cells, you most likely will start to see more and more things on PRP and stem cells. And so you'll start to see a lot of, pain treatments, discussing stem cells and things like that. And I did a little Facebook Live on my own page also regarding, stem cells and what are they, and what can they help with, and kind of be aware of, the stem cell products that people are talking to you about, because stem cells mean a lot of different things.
Yes.
And traditionally now, with what we're doing with injuries and pain and things like that, the true only way of stem cells is actually bone marrow or fat.
Mm-hmm.
And there are products that talk about that they're amniotic stem cells, they're placental cells, or they're umbilical stem cells, and things like that, which are products that are from healthy births. They are technically, harvested from that, and packaged in whichever way, whether they're freeze-dried, whether they're cryopreserved, and all those things. And so they are live cells when they're taken from these instances, and they're frozen. And so we have to kind of look at, are they still live cells when they're injected back, as well as the safety factor of all these things. And we're still learning this. The process of these type of tissues are under a different scrutiny than particularly FDA like medications. And so we're running into things that we have to be aware of with safety issues of the way that these cells are derived. Should they be under the scrutiny more of the FDA? And right now, that's where the controversy is that the FDA is looking at, we need to probably regulate these type of cells a bit more because of the category that they fall into. Are different regulations.
Right. And so, I think, like you said, stem cells are a whole topic, and I think people should take a look at, what you've posted already for some really, good information, because, it's a lot more complex than it sometimes I think is presented. And so I think, as medicine is beginning to understand that, it's good to kind of proceed with, a healthy dose of, caution and understanding. But a lot of what you do, especially with the PRP, is very, simple and very common, in a sense, not in the sense that it's simple in and of itself, but, we're using things that come from a person's own body,
right,
and injecting it back. So this is your own material, and so a lot of the concerns, like you said, that can be brought up with stem cells and using products from someone other than yourself,
right,
are not really an issue when you come to your type of injection.
Correct, right. And so it's done in the office, and your platelets go back to you, versus some of these other products, have to be put into a facility to cleanse and things like that. And so that's kind of where we are running into things where we need to be cautious and conscientious about is that factor of it, as well as claims of how live cells and things like that, because after these products are kind of thawed and frozen, or not frozen anymore, really what type of live cells are we having anymore? And so that's really kind of what the big thing is because we will get people saying, we're injecting live amniotic cells, and we really don't know that. Will they stimulate a growth response or factor? Possibly, yeah. I mean, there's an inflammatory response that comes from that. However, if we're not 100% sure that these are, have enough live factors in it for us to state, live amniotic cells or stem cells, is a little bit misleading to the patients in public, because you're expecting one thing and you're not really getting that. And there's just the glitz and the glamour of saying live stem cells that make it feel like it's superior to one thing or another, and we don't know that either. And so being able to, use your own blood and your platelets, we know that comes from you. We know that usually gets a good response of sorts. And in general, really, price tag is a bit different when you're talking those things, which gets it a bit more affordable for patients, and the safety factor is there too for patients.
Yeah, absolutely, absolutely. So talking a little bit, moving more towards sort of maybe the hormonal aspect of sexual health. We talked a little bit about how looking at our hormones, when it comes to improving sexual health. A lot of time we focus on the main sexual hormones: estrogen, progesterone, and testosterone, both in men and women. But there are sort of all the hormones play a role. Estrogen and progesterone. There's a lot of controversy, I think, that surrounds that with women. Some of the studies that we did that were done 10 years ago, specifically the Women's Health Study Initiative, put out just sort of, it's a lot of what conventional medicine has sort of based its current recommendations on. But now, as we've done more studies and understand hormones a little bit better, that we realize it's a little bit more complex than that. We're finding that the type of hormone, so there are subtypes of estrogen, and there are certainly types of progesterone. There's natural progesterone versus synthetic progesterone, and there's several different types of estrogen, and those types really do play a difference, in what they actually do in the body. And so, when we begin to look at hormone replacement, whether you're perimenopausal around that time period or postmenopausal afterward, it's not really just simply an answer of, okay, one type of estrogen is just the same as another, And then we're finding that the route of administration makes, a big difference as well. Traditionally, what was studied was oral, formulations. And what we're finding is that the transdermal, formulations, are a lot different in how they affect the body, And so this is the movement when you hear people talk, or maybe you perhaps yourself already have, explored, bioidentical hormones or compounded hormones. And the idea is that, what's available by prescription, is not sort of as detailed, I'll maybe use that word, or as specific as, we can create through compounding. And so, if you have specific, issues, maybe a family history of, breast cancer, or a family history of, ovarian cancer, and you may be sort of really hesitant, about exploring some of these issues. This is where maybe, speaking, with a physician that kind of understands this hormone perspective, is worth looking at, because there are a lot of benefits to, just for a second, female hormones that we're finding, to have them to, continue beyond just, menopause. Estrogen can have tremendous effects on memory, continuing to, replace estrogen, through menopause, and maybe even considering it during, and after perimenopausal period, can really maybe help that longevity. And so that's sort of the challenge that's coming out there right now, is saying, okay, estrogen transdermally specifically, and certain types of estrogen can really help brain health. It can help heart health. And so, perhaps just sort of saying, okay, we need to, stop it at a certain biological clock time, is sort of different. I don't know if your perspective and through what you do and what you sort of counsel people has changed as you've sort of seen, these things come across. you know?
Well, I mean, I have patients that come to see me for, the O shot or the P shot, and I'll delve into their history and, ask them, if they had their hormones checked, if they had their thyroid checked and things like that. And, quite a few will admit that they were seeing someone full hormones and they were feeling good, and they just kind of, were feeling good, missed an appointment, and then just kind of forgot to kind of get back on that track. And never really put kind of two and two together with like their changes of how they were feeling um, with no longer being on hormone replacement, and because for them was a gradual kind of change where it wasn't the next day they felt something different,
Right.
And I always counsel them back of let's kind of get those checked again,
Right.
because you were on them for a particular reason, and let's see if that reason is still present, or if there's a change where it needs to be adjusted more, because that in itself can also, can affect a lot of things, because they talk a little bit about memory issues, and although they may not be seen for that, they do click a box that says, these are part of some of the symptoms that they have, or other things that may lead to that discussion of, okay, it may be time to kind of start to explore those issues, and that's when it'll come out. Oh yeah, I was on, a couple years ago. Okay, when did your symptoms kind of start? Well, maybe,
Right.
6 months to a year after they,
Right.
they stopped, or around that time where it's like, okay, maybe that was a little bit more of a, things, because at the time, some are talking about, well, I didn't notice, it was either such a subtle change for them,
Right.
that they didn't notice as big a difference, or it was a big difference and they felt so good and didn't necessarily attribute it to that, once they kind of forgot about it or stopped taking it.
Yeah. And I know, safety, can be a big issue, probably maybe the biggest issue or the biggest, barrier. And I think that that's probably, going to be each individual person, sort of making that, decision for themselves. But, I think that people probably don't realize the amount of, I'm going to say, a big word like xenoestrogens, but, environmental estrogens that we actually, encounter on a daily basis just from different compounds and chemicals that we may have in our food, in our plastics, and things like that, that also are, intake, through us eating, through contact with our skin, that, are what we call endocrine disruptors. So they disrupt that endocrine system, and create changes. And so, I think sometimes medicine hasn't always factored those things in, when they talk about the dangers of or concerns of estrogen and progesterone, replacement given by a physician. And so, but there are certain definite ways that we can monitor that and take a look at that, looking at urinary metabolites of estrogens and things like that to monitor that. And I think that that's, again, something that, isn't always sort of on the radar screen, typically in, your conventional treatments.
Right.
So, something if for you, maybe you want to be on something, but more closely monitored, is something that absolutely can happen. And then, like you said, looking at hormones, is bigger. And so I've had people, like you said, come in with, specific sexual health issues, or fatigue. And we do correct sometimes the testosterone or the estrogen and progesterone, but they still sometimes struggle with that. And, like you said, looking at thyroid and looking at cortisol, is definitely, our other hormones that are active in our body that, need to maybe be looked at and addressed. So, and for people who, might be in sort of that, in between of saying, well, maybe I don't really necessarily want to start, prescription hormone, even if it is, compounded, there are some herbal options too, and so black cohosh and, chasteberry can also be, things that are used, as well as different types of what I call nervines, which is sort of a whole nother topic in itself, of different herbals, that can help if, again, people are sort of, hesitant to go into sort of that medical prescription route. And certainly, again, mind, body, when we do talk about sexual health, I think a component besides, sort of that hormonal, like you said, libido, energy component, and beyond the physical, structural, component is also, obviously, the mind itself, and, psychological issues that play a role. I don't know how much, you sort of, have, are, dealing with sort of trying to tease through those issues when you see somebody.
Yeah, I mean, it's difficult, obviously, for men and women. There are a lot of factors that go into that, right? And so we take that into consideration, obviously. Patients sometimes are aware of past issues and things like that. And so, in general, those can play a part in having trouble and things like that. And so, we recommend counseling and things like that to help kind of tease that out. But, that's sometimes someone's part of someone's history, and it's a difficult thing to kind of treat and deal for patients. But if they're aware of it and know it, that's kind of one of the first steps of it is kind of becoming aware of those issues that may have happened in the past or things like that. But in general, it's something that you would have them talk to.
Yeah, and that's why a lot of times you and I in my office here will work together because, putting those two components together. I think when you're talking about sexual health, definitely, you have the, some hormonal exploration sort of to make when you're trying to tease through and figure that out, as well as some of the mind body sort of issues. But like you said, I mean, that's just a piece of it. Some of it can just be, as we get older, we've been on the earth for a while, and we just have, physical issues that can, be sort of a barrier to, sort of that optimal enjoyment. If you were to say for women, what are sort of the top three, sort of physical diagnoses that you see with what you do that that what you do seems to make a difference?
Sure. So in general, for sexual health for women, the top thing that women complain about is vaginal dryness, lubrication issues, things like that. Another top thing is sensation, or difficulty with, they were able to achieve orgasm, and it's difficulty now for them to achieve orgasm. And then the other issue that PRP can help that women sometimes don't talk about is urinary stress incontinence.
Yeah.
So we're in the pelvic floor area, and we're trying to help improve the muscle tone and the sensation in that area. And some women, along with the issues with aging or childbearing, childbirth and things like that, have come across where they've had urinary stress incontinence. And that may not be why they're coming in, but when talking to them, they're like, oh yeah, that's some of the things that I have a problem with also. And they're pleasantly surprised that this can help for that also.
So if you're having, like you said, vaginal dryness, if you're having, issues, achieving orgasm, if you are, like you said, having pelvic floor sort of muscle issues or pain, if you've explored, hormonal treatments or any other type of treatments and still are, looking for answers, I think, coming to see you and get a consultation is definitely worth, considering, like you said, with what you guys have available. Now, for men, what would you say, are the biggest things?
So for men, it's a little bit simpler in why they're coming in. Normally, it is they're having a decline of erectile function that they've noticed. And so for them, it's a wide range of spectrum. Some they're just starting to notice it, and they notice it for a little bit. They still have good function. However, they notice it's not as good as it was before. And they want to maintain or improve what they have. And those are actually the best candidates for maintenance. I mean, just in general, like if you miss a couple of days at the gym and you go back, it's easy to kind of get back on track. However, if you've gone to the gym and then you don't go for a year or two, it's much more difficult to kind of get that stamina, endurance, strength back. And that's similar with men, when we're talking about this type of issue or organ. And so, it can help for all ranges of it. However, expectations of how many treatments and things like that changes for men based on really like their function of coming into things. And so when you catch it early enough, like in anything, it's easier to treat. And as well as, at that point, testosterone may not be a big issue in terms of or hormones. It just may be that aging process that we're having in that organ. And so mainly that's the biggest thing for men is that they're showing a decline in function. They also have had success with patients, and they've wanted a size difference and things like that. That's a little bit harder to kind of predict on patients. However, I've had success with some patients where they, in addition to declining erectile function, have had improvement in that, and have also reported to me that they've had improvement in size changes and things like that. So that's not a necessary guarantee of the treatment. However, it's a good byproduct.
It'd be a nice byproduct of it, I'm sure, for most men.
And in general, that's an important thing sometimes for men is that. So
I also know that some men, we talk a lot about women and pelvic floor dysfunction, but with men, they also, have issues too,
right.
With pelvic floor pain, and sometimes that's just attributed to, being a hernia or something like that, but sometimes the pelvic floor can be a lot more complex even for men.
Correct. And so that would need to be, evaluated a bit more in depth than a consultation for erectile dysfunction. Yeah. But it all plays a part too, the pain that's there. And so, it's worth exploring the reasons why, with, compression of nerves and things like that, or prior procedures like prostate issues and things like that have contributed to the pain. And so there are new and more things that we can offer to patients that have pain, pain in the perineal and the vaginal areas.
So, if you're looking towards, seeking some more answers in this area, if you, begin to look for some options and haven't really, been, have gotten very far, like you said, I think, sort of looking at, things obviously from a hormonal standpoint, and again, not just getting an extensive sort of hormonal look at everything, and then obviously all of the different, procedures that you do and offer, and looking at PRP, as an option for sexual health is definitely looking as we age and we age better, as we begin to find those, secrets of longevity, quality of life is important, and sexual health is just an important part of that. Yeah. Well, thank you very much for coming in here today, Dr. Moon. Dr. Moon, again, will see patients here at Balanced Physician Care. She has her own practice, which is NuMoon Regenerative Medicine. Your website and contact information.
So phone number is 904-580-6777, as well as website is www.numoonprp.com. So it's NuMoonPRP.com. As well as we have a Facebook page under NuMoon PRP or the name of the practice. And you're welcome to message or set up an appointment via the website or Facebook page.
And I know you also, like you said, do kind of some of your own, little live presentations and stuff like that as well. So probably check out your website,
Check on my website. There's a YouTube page as well as Instagram and kind of Twitter and all that kind of stuff. So we're in the day and age of social media, where you can find me pretty much on those and ask a question from any of those platforms. We'll get back to you as soon as we can, or get you in for a consultation if it's a more in-depth kind of question.
Absolutely. Well, thank you very much.
Thank you.
My name again is Dr. Sharyl Truty. I'm owner of Balanced Physician Care. Our website again is Balanced Physician Care, so balanced with a D, physiciancare.com. And again, any questions that you may have, please feel free to email us at our membership at balancedphysiciancare.com website. So our next Facebook Live talk will be in 2 weeks. And another topic that I know a lot of people have questions on is is called the ABCs of CBD. So, people are asking, we'll talk a lot about marijuana, a hot topic. One of the plant components of marijuana is CBD. And so we'll be talking about, it's available often over the counter now in many different formulations, and what that's all about, what the hype is, and what might be good for you. Please also check out our website for a lot of upcoming events. We have a couple of webinars that are going to be coming ahead in October and November on our specific unique membership-based practice. So if you've heard about that and kind of want to know more for it as a health care option for you in the coming 2019 year, might be worth taking a look at. And then we're going to again be back at Leaf and Bean. I don't know if you've ever checked them out, but a great, sort of healthy, fast place to get some great food over on San Pablo and Beach. Leaf and Bean, when we're going to be talking about tea again. She just has fantastic knowledge of tea, and we're going to be talking specifically about green tea, but hopefully sort of from a very interesting culinary standpoint, besides just the health. So again, thank you very much for joining us today. Hopefully we'll see you again in some of the upcoming weeks, and look forward to maybe you joining us again and talking about some of the more unique things that you do here. Thank you very much, and have a great afternoon.